Okay, well, we've got some phone calls here, and I know we need to take a break
Sure.
pretty soon, but I think we can try to get one in. Let's take Diva from San Francisco. Good morning, Diva.
Hello.
Hi, you're on the air.
I see.
Do you have a question for Dr. Mele?
Well, I wanted to know how much it costs.
How much a tummy tuck costs? It depends a lot on what needs to be done. For some folks, it's a relatively short procedure, may just take a few hours, or even an alternative procedure could be offered, like liposuction or a mini tummy tuck. For others, like the last patient we saw, where it's a rather massive loss of weight, then there's a lot of extra skin, they can take 4 or 5 hours. So the cost can range quite a bit.
Okay, thank you, Diva. Let's take Christine. Good morning, Christine. You're on the air. Do you have a question for the doctor?
Yes, I do. My question is, how long do you have to wait after you give birth before you can have a tummy tuck?
It's probably good to wait a year, and that's also true for the bypass surgeries. With the bypass surgery, it gives the body a chance to sort of adapt physiologically to its new setting. With childbirth, the stomach continues to improve for a year, and we kind of want it to be at its maximum improvement before we start.
Right, so your body does, on its own, get better, yeah. But after a year, if it hasn't, and you've been exercising and you've tried everything,
then it's much less likely that it's going to at that point.
Okay. Also, I would imagine if you plan to have more children, is that something not advisable to do?
Usually I advise folks to wait. You know, if they're planning on having more children, certainly in the near term, usually would have them wait and go through childbirth, and then when they're done, do the tummy tuck. Because if they have another child, they get pregnant again, it may stretch everything out.
Yeah, all that work for nothing.
Yeah.
All right, we've got to take a quick break, but for more information about Dr. Joseph Mele, you can call him at 925-943-6353 or check him out on the web at drmele.com or at sanfranciscoplasticsurgeryblog.com. And when we come back on Body Beautiful, we'll continue talking about tummy tucks, and we'll be taking your phone calls. For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows. Welcome back to Body Beautiful. We are talking about tummy tucks with Dr. Joseph Mele. And first, let me remind you that we'll be taking your calls live on the air with any questions you might have for the doctor. Here is the phone number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we give you today, you certainly want to consult your own physician as well. Second opinion?
Second opinion is good.
It's a good thing.
Board certified is good.
Always good. Let's go to the phones. We have Zenon from San Leandro. Good morning, Zenon.
Hi, good morning.
Good morning. Do you have a question?
I want to ask, what's the age bracket?
The age bracket for tummy tucks?
I believe so.
I think so.
Yeah.
Okay. The age is important in that, you know, someone has to be at least 18 for the lower end, and again, sort of at the end of having children. And as far as the upper end, there really is no upper limit in terms of age. The thing that I look at is health, and there are young people who are not healthy and older people who are not healthy, and neither would be good candidates for this type of a procedure. As we get older, there's a little more screening that's involved. I'll order some tests that I wouldn't order in a younger person, again, just to try and keep us out of trouble. But the age itself is not an absolute contraindication.
And using Kanye West's mother as an example, if your doctor says you're not healthy enough to have a procedure done,
that's probably not a good time to do it. You know, and sometimes it's a temporary problem. It's a medical condition that needs to be treated, and it's just not under control. Like if someone has diabetes and their diabetes is out of control, not a good time to do surgery. But if you can get it under control, then they do very well.
Okay. How long does a procedure take? Somebody wants to know. So
the procedure, it depends. Again, it depends on how much we're tucking. So anywhere from 2 to 5 hours at the sort of the outset.
Okay. And can this be combined with other procedures?
It is probably the most frequent procedure that it's combined with is liposuction, because a lot of times we'll do a little liposuction on the side or in the lower back in order to make everything look the same all the way around. It also can be combined with breast augmentation or breast lifts or even breast reductions for the mommy makeovers.
Now, you don't have folks coming in there who, let's just say they have a lot of weight to lose, and they're kind of using this as a way to get around the hard work.
I do have some people who come in with that, and there's not a lot I can offer in that situation. The main thing that I want is that they're healthy, And if they're healthy and they're in good shape, but there's extra skin, there's just extra stuff that's disproportionate, that's where plastic surgery really has a role. It can be very, very helpful. If someone is 100 pounds overweight and they say they want to have liposuction to get rid of that, it doesn't work. The most we would remove at one time is 10 or 11 pounds. Then they're still 90 pounds overweight. They're not going to be happy with that much of a change. I'm not going to be happy with that much of a change. So I'll do whatever I can to get them to a situation where I'm going to be able to do what I do best.
So the point also, and we did a light brush stroke on this, but it's important that you cannot remove 100 pounds of weight. I mean, that would
that would be a very rare
dangerous.
exception to the rule. There are some folks who have 100 pounds in their pannus, where all that weight is right in that skin at the lower part of the abdomen. They have lymphedema, they have some fluid in there. In that case, yes, but that is the rare exception.
You know, and I've read this, and I just find it very curious that we know that any fat that's around the heart in the midsection puts a strain on the heart.
Yes.
If a person has that fat removed through liposuction or through a tummy tuck, does that actually still help the health of a person?
That's a great question. And actually some of that research was done right here in the Bay Area with large volume liposuction. Now, this isn't normal liposuction where you go home the same day. This is liposuction where you're kept in the hospital usually several days. You may require a blood transfusion. It's a much bigger operation. But in these large volume liposuctions where 10, 15 liters are removed, there is improvement in problems with diabetes, improvement with blood pressure, improvement with a lot of the things that we find improvement for when folks lose weight.
Okay, so this might be a situation where your physician actually orders something like this and says this is...
Yeah, but again, that's unusual. Yeah. Usually we're doing diet, exercise, the sort of standard stuff.
Of course.
It's not as glamorous, but it does work.